see visible damage to the vehicle. Even though at 13 Gs, you've now, for example, a 100-pound female may have experienced 800 pounds of vector stress to her body. So if you take these cars and you do 100 to 150 test crash at 13 kilometers an hour, you won't see any visible damage.
Does it have to be a crash from the back? Can it be a crash from the side? Can it be a crash from the front?
It doesn't necessarily have to be a crash in the back. That's the most common one that we see, but you could be T-boned, as well as if you had a front crash and you had the same acceleration, deceleration phenomena, you're going to end up with the same injuries.
Is there a test you can do on yourself to know if you have it? And I know that sounds simplistic, but they say if you want to know if you're having a stroke, try to smile and raise your hands, that kind of thing. Is there something you can do with a whiplash injury yourself?
Well, the first thing you have to know is you have to know when you have to seek treatment. And there's some general rules. For example, if you have significant pain at the time of the accident right from the get-go, sufficient enough that it interferes with your sleep, you probably should get care right away. In my experience in 30 years of doing this job of work, I find that the window of opportunity to manage these is in the first 3 months. If 3 months goes by and you still have pain, there's a very good chance that you're still going to have pain at 1 year. And if you have pain at 1 year, 15 years later, you may still have the same problem.
It can recur.
It just never resolves.
Be there.
It never resolves, and it places you at risk for additional injury.
Well, as a back pain specialist, you know so well, in the olden days, they used to say, stay still, don't move, go to bed, ice it, put heat on it, but don't move. Now they say, if you have an injury, a back pain injury, you can move, get active. Well, not all, but what about whiplash?
Same thing. The first thing you must do is, inactivity is the worst problem. If you start babying yourself, and if you start, for example, wearing a collar for inordinate amounts of period of time, you're going to develop even more atrophy of the supporting muscles. You must do whatever you're capable of doing. So moving about, trying to carry on with the activities of daily living is critical. So yes, keep moving.
And how do you treat it? I come into your office, I'm diagnosed, I have whiplash, where do you start?
Well, the first thing you have to start is you have to recognize that there's many different pain generators in a whiplash injury. It may be the muscles, it could be the ligaments, it could be the nerves, it could be the discs, it could be the joints. So you have to sort of start off and find out what the pain generator is and direct your modality of therapy to that. The more skill sets you have in your armamentarium, of course, the better it's going to be. As an old mentor of mine used to say, if the only tool you have in your bag is a hammer, everything starts looking like a nail. And that's really important for whiplash victims to know as well. Every therapy has a ceiling whereby if you continue to do it, you're not going to get any benefit. And in Surviving Whiplash, I talk about the rule of 6. And essentially that says you can try 6 of anything. If you don't notice a significant clinical result in 6 visits, you're unlikely to notice any in 12.
Okay, 6 visits. Alternative therapies that work effectively?
They may or they may not. When you look at neck injuries, it's marked by what we call idiosyncrasy, which is just a $5 medical word meaning what works in one guy doesn't necessarily work in the next. So I think that a patient has to be their own advocate. No one knows their body better than you.
Exactly.
If your body is injured, trial a therapy and see what your response to it is. If you notice a response, carry on with it. Once you feel that you've reached the ceiling of that response, choose another therapy.
Listen to your body. Personality medicine, the future. Surviving Whiplash, Preventing Whiplash is the next book, I'm sure. What can you do now?
Well, that's very difficult because it's at odds with the automobile industry. The automobile industry is based on, there's 2 concepts. One is called plasticity and the other is called elasticity. Plasticity is what occurs in motorcycle helmets, for example, where the helmet shatters to take up the force of the blow, protecting the skull and protecting the brain. In cars, because of the costs of repair, we've built into what is called elasticity. The car doesn't experience any damage, but it transmits the entire force to the occupants.
Didn't know that.
That's right.
So what about these head rests and things like that, helping or hindering?
They are helping, but they have to be adjusted to the correct level. Ironically, one of the things that may be problematic is the seatbelt itself, because essentially what it does is it fixes one shoulder and increases the torque. So that, in fact, that's one of the things that may be contributing to whiplash injuries.
If you were designing a seatbelt, would you make it come from the top of the car? I don't know how you'd do that.
Well, I would imagine a four-pointer would be more
Be better,
like the
more
jet
effective.
fighter, right?
Really?
Yeah.
Because we know we have to wear our seatbelts. Makes sense. Don't want to
They
be
certainly
thrown out of
do
the car.
protect against critical injury, but in these low-impact injuries, they may not be doing the job, but they're not designed to protect us during
Right.
that job.
And where do you put the headrest?
It should be at the middle of the back of your head.
Okay. Middle of the back of the head. That makes sense. What about going to the gym? Building your core strength. I'm thinking if you're in better shape and you, this could be wrong, and you get hit from the back, if you have good core strength, good fitness, good posture.
Unlikely to help you. It's all over in a blink.
Darn.
But it is true.
Actually good. Then I won't have to do any more of that core strength thing.
Well, some people are at greater risk, and you're absolutely true. Like, for example, women are 2.5 times more likely to experience a whiplash injury, as are elderly, frail people, probably because of the lesser muscle mass. And certainly if you have degenerative changes in the neck, you're more likely to experience. But fitness is good, but it's not going to help you.
What if you're dealing with the chronic pain every day and you're a little out of your mind, and as you know, when you have chronic pain all the time, you either tend to drink or you cry, you get exhausted, your marriage falls apart?
It's very much all part of the package. I think probably the most important, simple advice that I can give to people is, one, educate yourself. Understand the mechanism of the injury, understand the anatomy of the injury, so that you can become an advocate in your own care. So see that you understand that. Secondly, if you can understand how to deal with the insurance company, which is probably not your best friend at most times, and know how to get competent legal help when it comes time to seeking compensation, those aspects of it are the most important.
Right, and that's in here.
That's all
your
in there.
rights, your ability to work, all of that, how to discuss costs with your lawyer, all the nitty-gritty details you need to effectively treat it.
When you look out there and what's available, there's a lot of literature out there on whiplash, but it's academic literature. It's meant for doctors, for therapists. There is not a Mother Goose version that helps people who may be experiencing a significant amount of pain and are a bit foggy from their injury, and they don't want to wade through all the medical jargon.
Exactly.
They want it in a clear-cut fashion, and that's what Surviving Whiplash was designed
Well, I'm
to do.
happy to have this book. I hope I don't have to use it.
I hope you don't as well. Thank you very much, Fanny.
Nice to see you. Dr. Mark Frobb, Surviving Whiplash, Saving Your Neck Without Losing Your Mind, Your Injury, Your Recovery, and Your Rights. Coming up, we babble on with the bodacious Babs Chula about her career, her current challenges, and her future plans.